Dr. Chinwe Ochu is the Director of Prevention Programs and Knowledge Management, the department with the NCDC. She joins us from our Abuja studios. Welcome to the program.
Thank you very much, Millicent.
I'd like to begin by asking your assessment of the second wave in Africa, because according to the WHO, the rising deaths, overstretched healthcare systems, the lethal variants are all staring us in the face.
There is no doubt that the second wave has been more vicious than the first one, with Africa recording very high number of cases with this second wave. As a country in Nigeria, we've seen that increasing number of cases with the second wave. For instance, last year, week 26, when we had the peak of the first wave, we just had over 4,000 cases as the highest number of confirmed cases that we recorded on that week. But with this second wave, week 3, we recorded over 10,000 cases that week. So we have more cases. The second wave is more vicious. And like the WHO rightly pointed out, it could be as a result of the various variants of the virus that we have that have been shown to be more infectious than the original virus. And the country has not been spared. We've also been able to detect some variants of COVID-19, of the SARS-CoV-2 virus in the country. So a lot is dependent on trying to keep ourselves safe through the same preventive measures, because it's the same kind of preventive measures that protect you from one strain that will also protect from the other strains.
But would you say that there perhaps is good news already, because the WHO is saying that Africa peaked around the 6th of January 2021?
The WHO is reporting on the cumulative data for Africa, and their data could be pointing to that it's possible the continent peaked on that January 6th, the week of January 6th. But for us as a country, though we are seeing a slight dip in the number of cases, we are interpreting that very cautiously because we know there are multiple factors that could lead to a pseudo decline, so to say, in the number of cases. A lot depends on how much tests we are running, and then, of course, how we are also reporting. So we need several weeks from now to be able to say whether we have started going down that sustained slope of the other side of the second wave. It will be too early to make that assumption now. So we will continue to strengthen our public health interventions and keep hoping that very soon, especially as we continue to wait for the vaccine to be introduced in the country, it's more compelling now for us to stay safe until that happens and we're able to cover a good proportion of the populace that will give us that herd immunity.
Let's look at some of the measures the NCDC has been putting in place, and one is the patient's handbook for COVID-19 home-based care. First, we're looking at a book that is about 32 pages. Some people say it's a lot. Couldn't have been less, 10 pages or even less than that.
Millicent, that book is actually very user-friendly. It's colorful, and the font size is good. Yes, what we are trying to do is to make sure that people have the information they need available to them. So we needed a comprehensive handbook that will cover all the thematic areas in home-based care for COVID-19 patients. So we have the various sections, and all the sections may not apply to a particular individual at the same time. We also have the table of contents that can guide you directly to the section of the book that you want to look up. And we are encouraging Nigerians to download this handbook. Is a very useful handbook to have. Even before you have a case to manage, it's good to get yourself familiar with the content of the book. Very interesting. You can finish it within 15 minutes. It tells us how we can manage cases that do not have symptoms and those that have just mild symptoms at home safely, using caregivers, designated caregivers, and how these caregivers can stay safe while managing these positive cases. Those who can be managed at home are those who have tested positive to COVID-19 through laboratory tests, but either they do not have symptoms or the symptoms they have are very mild, and they do not fall within the high-risk category, like those that are elderly above the age of 60, or those with underlying comorbidities that could put their lives at risk. So this book is very, very useful and tells you what to do, how to self-isolate at home, and how you can take care of your loved one who has tested positive for the virus and manage that person until he comes out of the infectivity state. So it's a very important book that can be downloaded from our website on covid19.ncdc.gov.org. And you keep it handy at home and share with your friends.
Finally, Dr. Ochu, much of perhaps the success of home-based care really depends on the patient. What's your assessment of it so far?
I wouldn't really say it depends only on the patient. There are lots of key players in home-based care of a COVID-19 patient. You have the patient, you have the caregiver, you also have the relations that have a role to play in providing the moral and psychological support to the person on isolation. You have the state case management team that will carry out risk assessment to know whether this person needs to be managed at home or should be taken to a treatment center. And they also follow up in case there is deterioration in the state of health of the person, so they can quickly transfer the person to a treatment center. So we also have the public health officials and even the doctors themselves, the clinicians and healthcare workers that will eventually take over the management in case they have to move this person to a treatment center. So a lot of people have a role to play. The patient has a role to play by maintaining those strict public health measures of wearing face masks, proper hand and respiratory hygiene, keeping the environment safe. The caregiver has a role to play in knowing what to do to keep himself or herself safe, and that is why the handbook is very, very useful. Other members of the family also know what to do to make sure those that are negative remain negative, and those that are positive access treatment as early as possible. So it is a collective effort. Everyone in that home and even in the whole of the health system has a role to play in a successful home care management of COVID-19 patients.
All right. We appreciate your time on the program. Thank you, Dr. Chinua Ochu, Director, Prevention Programs and Knowledge Management Department with the NCDC. Thank you for joining us on the program.
Thank you very much.